Good evening. This is Rosalind at Shy Rosalind's Eclectic Experience. Thank you for joining me tonight. Tonight's presentation is regarding Black women and the healthcare system, particularly for prenatal and postpartum care. Tonight's topic is why are Black women at the bottom of the healthcare system? Before we get started, a little bit of housekeeping. This presentation is not medical advice. Sources are cited at the end of the presentation for your research pleasure. Consult with a physician if you are experiencing a medical condition. First things first, care is not equal. It's not. There are several. There are several concerns with the value and the quality of care in the United States. First is distance, then insurance coverage. There are particular disparities for Black women in healthcare and the availability of alternatives. Now, first things first, distance does affect care. There is research that has shown that more than half of the United States rural counties no longer have hospitals where women can give birth and postpartum care, leaving thousands of pregnant women in outlying areas with few options for obstetric care, which definitely affects the quality of prenatal care that a woman would receive. It affects postpartum care, follow up care, and the beginning of the pediatric experience. Then there are prenatal and postpartum health issues for particularly concerning for Black women. So the three questions are why, how, and what do we do to correct or alleviate the problem? So some of the disparities are broken down are 89% of white women initiate care in the first trimester. 79% of Hispanic women initiate care in the first trimester. And unfortunately, only 75% of Black women initiate care in the first trimester. Now, that could be going back to distance. It could be a lack of insurance care or poor insurance coverage. It could be even if you're in an urban area, it could be a lack of availability for doctors. So there's several variables out there as to why Black women tend to have lower lower quality of care, particularly in the first trimester. Then the quality of care, 79% of non Hispanic women reported adequate care. 69% of Hispanic women reported adequate care. And only 68% of Black women reported adequate care. So we're talking adequate as in ability to see a doctor, ability to the ability of prenatal and postpartum care on a regular basis, waiting time, once you're in the doctor's office, how long you have to wait, um, and the follow up from the doctor or the nurse practitioner or wherever you're receiving your care from. So, what are some of the things that women and healthcare providers can do in order to provide better care or more quality care? And basically, everyone has a role to play. The doctors have a role to play, the patients have a role to play, and state and local communities and state and local governments also have a role to play. So, according to Wanda Barfield from the Center for Disease Control, um, women and their friends and family need to be able to communicate and need to know the warning symptoms if something's going wrong, if your blood pressure is too high and it's not coming down, if you're having pain, if you're, God forbid, you're bleeding, that means that's an emergency situation. Women should need an advocate. And there's actually a New York Times article that I'm going to discuss probably live, that it's an example of a particular woman's journey through pregnancy and the lack of adequate care. Healthcare providers can help patients manage their chronic conditions that they have before they're pregnant, and then make sure they actually listen to patients and address the concerns. There's a good example is the tennis player Serena Williams. When she had her child, she has a history of blood clots, and after she delivered her baby, she kept complaining that she couldn't breathe, and the doctors basically dismissed her. Now we're talking about Serena Williams. We're talking about the number one female athlete in the flipping world, and this is not a woman without means. She's probably in one of the best. She's probably was in one of the best hospitals in the country, and they dismissed her. And it got to a point where she literally could not breathe, and they finally did a scan and found a clot in her lung. I mean, if somebody like that is dismissed by a healthcare provider, can you imagine, a regular person? So, yeah. So there's something that healthcare providers and hospitals can also step up to the plate on that regard. And the other thing that's in conjunction with this is that hospital and healthcare systems should be able to link up and provide some cross communication. So the private doctor, the private obstetrician should be able to communicate and provide information to the hospital that the baby will be delivered at, and then keep that communication going so that there's a better access and more continuity of care. And then you have state and local communities can step in and do the community side of health, encouraging people to go to encouraging people to get their checkups, encouraging people to get screened, providing social services for people who need additional help in finding and maintaining regular health care. And then some of the sources that these are just some of the sources that I use for the presentation. Um, there's you can go to Centers for Disease Control. You can check out the Journal of Women's Health. You can also go to Black Women's Health Project. They are with Boston University, and they have an extensive research on Black women's health, not just prenatal and postpartum, but also fibroids, sleep, or lack of sleep, that sort of thing. Um, there's they have like a plethora of information on different health conditions for particularly for Black women. So I would encourage everyone to go there as a first resort, to go there and look at what they have to say. And my other source, this is the article that I'm going to be talking about separately. Why America's Black mothers and babies are in a life or death crisis. It's from the New York Times back in 2018. I'm going to be talking about that separately because I want to be able to share the screen and talk about this particular woman's journey and her issues getting proper prenatal and postnatal care. So, this is just like an introduction to the problem, um, and some suggestions. And what I'm going to do next, I'm going to pull up the article itself and share the screen, and then we can talk about that as well. So I hope everyone has a wonderful evening. Thank you for taking the time to listen to my presentation. I hope you guys can join me when I discuss the article. Um, and as always, please like, subscribe, and comment. And I will see you all next time.